You know, when we talk about fighting cancer, our minds usually jump to finding that next big thing, right? Some brand new, powerful weapon to just obliterate tumors. But what if the real breakthrough isn't a new weapon at all? What if it's about making the weapons we already have smarter, stronger, and a whole lot safer for the very person we're trying to heal? Take chemotherapy. It's a powerhouse, no doubt about it. It's fantastic at killing off those rapidly dividing cancer cells. But here's the catch. It's kind of like a bull in a china shop. It doesn't really distinguish between the bad cells and the good ones. So while it's fighting the cancer, it's also waging a war on the patient's healthy cells. It's this brutal trade-off that sits at the very core of the problem. And that collateral damage, it leads to this whole cascade of awful side effects. We're talking about that bone-deep fatigue, constant pain, nausea, and really critically, it can hammer the immune system. That can lead to things like neutropenia, which is a huge risk for infection. It can get so bad, in fact, that doctors actually have to stop or lower the dose of the chemotherapy. And that can seriously impact a patient's chances. So this all leads to a really powerful question. Instead of just searching for the next silver bullet, what if we could refine the tools we already have in our arsenal? What if we could somehow tip the scales in our favor, make chemo even more lethal to cancer, while at the same time protecting the patient from all that friendly fire? This is exactly where a new way of thinking comes in, an integrative strategy. It's a real shift in focus. We're moving beyond just a full frontal assault on the tumor and looking at the bigger picture. How do we support and strengthen the patient through this whole ordeal? And it just makes sense, right? If you can reduce those awful side effects, patients can handle their treatment better. They can stay on schedule, they don't need to reduce their doses, and all of that can have a massive impact on the final outcome. It's all about building resilience. So let's look at a really fascinating example of this in action. It's a botanical formula called LCS 101. And I want to be super clear here. We're not talking about some ancient folk medicine. This is a modern, complex formula that was developed with some serious scientific discipline. So what exactly is LCS 101? Well, first off, it's a patented formula. It's got extracts from 14 very specific botanicals. And crucially, it's all made under these really strict conditions called good manufacturing practice, or GMP. What that basically means is that every single batch is consistent, it's pure, and it's been rigorously tested using modern science. This is squarely in the world of integrative oncology. So how in the world does it work? Probably the best way to picture it is to think of LCS 101 as a kind of biological Swiss Army knife. Instead of just doing one thing, it's designed to do a bunch of different supportive jobs all at the same time. Yeah, the early research shows it's not a one-trick pony. It has this multi-targeted effect, which means it tackles the challenges of chemotherapy from a few different angles at once. Okay, let's break down the 3 big things scientists have found. First, it seems to act like a shield for healthy cells, helping to protect them from chemo's toxic effects. Second, and this is the really wild part, it actually seems to boost the chemo's power, making it even better at killing cancer cells. And third, it helps support the immune system by ramping up the activity of key defender cells. All right, so that's the theory, but what does the science actually say? Let's dig into some of the evidence from both the lab and from actual patient studies to see what's really going on here. Okay, let's start with what matters most, the patient experience. So, in one study with breast cancer patients going through chemo, get this, a whopping 70% of those taking LCS 101 said they had only mild fatigue or none at all. Now, if you know anything about the kind of bone-deep exhaustion that chemo can cause, you know that number is it's incredible. And the story gets even better when you look at pain. In that same group, 85% of patients reported experiencing mild pain or no pain at all. I mean, that points to a huge improvement in quality of life during what is an unbelievably difficult time. Okay, so this brings us to the million-dollar question, doesn't it? It's awesome that it helps with side effects, but does it get in the way of the chemo? Does this shield that's protecting the healthy cells maybe accidentally protect the cancer cells too? Well, the lab evidence is pretty stunning, and it points in the exact opposite direction. When scientists looked at breast cancer cells in a dish, they found that when they added LCS 101 to the chemotherapy, the rate of cancer cell death went up, and not just a little bit, significantly higher than with chemo alone. So it didn't just not interfere, it actually helped. And that is the crucial takeaway, this amazing selectivity. as the researchers themselves put it, LCS 101 seems to be playing this incredible dual role. It helps kill the cancer cells more effectively, while at the exact same time it's protecting the healthy cells. It is, quite literally, tipping the scales. So what does all this mean for the future of cancer care? Well, this kind of work is pointing us towards a big evolution in how we think about this, a real shift towards building a more holistic, more resilient patient. At the end of the day, this whole integrative approach is about changing the entire treatment experience. The goal isn't just to make the therapy more effective on a cellular level, but to make it more tolerable, more doable for the human being who's going through it all. It's a future where we focus just as much on fortifying the patient as we do on fighting the disease. Which leaves us with a pretty powerful thought, doesn't it? As we keep pushing forward in the fight against cancer, maybe, just maybe, the next giant leap isn't a stronger weapon at all, but a much, much better shield.